The work I'm going to be presenting about the healthcare supply chain with specific interest in how hospitals enhancing supply chain efficiency is work that I'm doing with Gary here. And so for all the difficult questions, just direct them to Gary and home and dry. But before I get to that, just a little bit about my research. My primary research areas are actually logistics or supply chain strategies and supply chain collaboration. And so even as I'm looking at healthcare supply chain, it's been the framework of logistics strategies and the supply chain collaboration. And in terms of overall picture, I'm currently working on projects to do with inventory management and supply chain efficiency with these three projects that are ongoing. One with the VA, another one that is what I'll be presenting on actually in a minute, and then another one with the Israel Covidian. The Covidian, they are actually medical devices manufacturers. So to the project that I'll be talking about. The primary motivation for this was, why is it that there is increased focus on supply chain efficiency in the healthcare sector in general? Several factors have contributed to this. First of all, there is a realization that indeed supply chain costs account for such a substantial chunk of operating budget in hospitals. Our study shows it's definitely over 25%, which is also cited in most literature, some going as high as 40%. And so for most hospitals, how do you then address costs with all these budgetary constraints? One of the ways is to focus on your supply chain processes, supply chain operations as a way of bringing down that cost. Another element is general, and this is a trend that has been there, the whole idea of consolidation in the procurement. So you find that hospitals, about 70% of them actually, are members of group purchasing organizations. And group purchasing organizations are essentially, consolidating agencies or brokers. So they bring together multiple hospitals, then negotiate contracts with manufacturers, and therefore they are able to give the hospitals, sort of better pricing, so to say. Another one obviously has to do with expertise too. We have more and more folks coming from the industrial sector, from Walmart and so many other retail sectors, going into the healthcare supply chain and working as materials managers in hospitals. What you start realizing then is there is trickle down of sort of this expertise that is already established in the industrial sector, in the healthcare sector. And so you start seeing again a greater focus on efficiency. And finally, and obviously there are other factors, is there is more focus on standardization in general. Have they succeeded? Of course not. But at least there is a push towards that direction. So you start seeing hospitals, for instance, there is the electronic health records, but there are also other systems like enterprise resource planning systems and GS standards, for instance, that tries to make it possible to track items as they move down the supply chain. So all these are factors that are creating that focus on supply chain efficiency. So in our study then, we said, okay, let's look at hospitals and see what are some of the factors that are driving the whole aspect of supply chain efficiency. There are multiple issues at play here. So we narrowed down on sort of what we call internal controls and sort of the external looking controls. Internally, hospitals are increasingly focusing on employing their medical, their staff. So, but primarily the physicians. Traditionally, you would find physicians could be employed full-time as, within hospitals, but also they can be contractors. So how does the whole concept of employing physicians translate in terms of how efficient the hospitals are? At the same time, we have nurses who are more often than not part-timers or, they are employed on a very temporary basis. How does that translate to operational efficiency at the hospital level? Because these are people who handle inventory. These are people who handle all major decisions that have to do with the material flow in the hospital. And then another element then, which goes back to what I mentioned, the GPOs, is the whole idea of consolidation. So when you join a GPO, what is the essence? What's the focus? You want to get concessionary prices. Does that pooling of multiple hospitals, given that as individual unit, hospitals have very, very limited negotiating power. So when they pull together, they gain negotiating leverage. How does that negotiating leverage translate to the efficiencies? And so we look at those key constructs, so to say, including systems where multiple hospitals come together, again, to build that negotiating leverage. And finally, also getting experts. These are contract money, we call it contract management, but they are really parties that manage hospitals. And then we control for a couple of variables. And so when we did analysis, what we did is we looked at hospitals in California, over 300 hospitals, and we've examined this over a 5-year period. I'm sure we can go further than that, but in the present case, we took data from the California system as well as data from American Hospital Association. And so we did regression to test how are these factors, primarily the internal controls, the physician employment and non-employment, as well as this membership to GPOs, affiliation with systems, and being contract managed. So, the issue of the incentives that you provide internally to the organization, to the hospital, and the type of relationships you build by creating this negotiating leverage. How does that translate when we look at the supply chain efficiency? And so as you can see, we have primarily, laser here, but the contract management, the negative number, as well as hospital-based medical staff, again, negative number primarily implying that the costs are going down, which means higher efficiency. And so what does this mean? Well, again, I'm just summarizing some of the findings. We find that physician employment has a significant impact on efficiency. Well, if most hospitals then are employing physicians primarily because of cost, we are demonstrating, or trying to minimize cost, and we are demonstrating that in fact there is an additional benefit that when you have these financial ties to the hospital as a physician, as well as the feeling that you are part of the system, will translate to better supply chain efficiency. Also, participation in GPOs does not necessarily translate to improved efficiency. And then the whole idea of contract management, in our opinion, translates to expertise that I alluded to earlier. That if you have supply chain experts doing the management of the hospital primarily, you are likely to see improvement in the efficiencies that you get to see. And so from going forward, we have a couple of things that we are looking into, talking about, for instance, other arrangements that hospitals have, as well as other data from other systems in the country. So that's it.